People on their way to work, people with comfortable lives, people who have worked hard, and some of them longing for a convenient retirement. But for many, insecurity lurks beneath the surface. Unfortunately, far too many people have bad teeth. All over the world there are millions of people whose quality of life could be so much better if only they had nice teeth. Let us tell that story. One such person is Inge Eberspecher, a preschool teacher in Salzhausen, just south of Hamburg. Today she can go to the market, laugh and make contact with people. With her old overdenture she would never have dared. The fear of it coming loose was an ever-present threat. But thanks to the Nobel Guide method, she was given new teeth within 1 hour.
Man kann ja anders lachen wieder. Das sitzt fest im Mund, man fühlt sich sicherer. Das Ganze ist was Sicheres und das ganze Auftreten ist anders.
Dr. Paolo Malò is active at more than 10 clinics around the world and is a believer in Nobel Guide.
Imagine if you are having dinner with the friends and you cannot eat the steak, you can only eat the potatoes. And then people say, well, eat the steak, it's good, it tastes good. And you say, oh, I don't feel like, of course you do not feel comfortable. And imagine if you're manager of a company and you have a board meeting and somebody tells a joke and you feel like laughing and you laugh and the prosthesis jumps out of your mouth. You lose your dignity, you lose your authority, you get humiliated in front of everybody.
Another doctor, Mick Dragoo, has been in Europe teaching dentistry and has given many patients beautiful new teeth.
There's nothing magical about it at all. Any dentist at all experience levels, whether it be specialists or general practitioners, can easily do it, no problem.
Dann war immer einer an meiner Seite, der hat mir dann ganz beruhigt gesagt, was gemacht wird. Und plötzlich hieß es, das 3. Implantat ist schon drin, wir sind gleich fertig.
3 years ago, Nobel Biocare called Dr. Peter Moy from Los Angeles. He went to Sweden, saw a Procera implant bridge placed in an hour. This changed his professional life.
It's much less discomfort, much shorter surgery time, and a quicker recovery time for our patients after this procedure.
Woodshop foreman Karl-Heinz Bent, age 69, has also recently been fitted with a new bridge in his lower jaw.
Man kann wieder richtig lachen, man kann singen, ohne dass die Prothese eventuell, dass man Angst haben muss, dass sie runterfällt oder irgendetwas.
The University of Lund in southern Sweden. Nobel Guide actually originates from here. Professor Per-Ingvar Brånemark started his research career in the 1950s, and here he discovered that metal titanium had unique characteristics.
Det vi den gången av en ren slump upptäckte var att titanet accepterades av immunförsvaret som vore det en kroppsegen substans. Vi fann också att benvävnaden till synes obehindrat växte längs titanytan. Och dessa observationer utgjorde grunden för en långsiktig forskning som ledde fram till det kliniska fenomenet osseointegrering.
Today there are 2 ways to go within the Nobel Guide concept. The model-based approach is using traditional mapping techniques and the planning is made on a stone model. This is then transformed into clinical reality using the special Nobel Guide products. The computer-based approach, powered by Procera, starts with a CT scan. It provides exact data for the dentist's planning. The Procera software provides the tools to plan implant placement in a 3D environment. The result goes online to Nobel Biocare for the production of a surgical template. The patient comes to a final visit and the pre-manufactured prosthetic solution, either temporary or final, is ready. The surgery is guided by the surgical template. No wobbling occurs and it is flapless. Within an hour the patient can leave the clinic with new teeth.
From the conventional standpoint, where we had to place the implants, wait a period of time, perform a second surgery, to this new concept where we can place the implants without having to reflect tissue and then immediately insert the bridge onto these implants. It's like night and day.
One of Dr. Moy's patients is Heidi O'Donnell. After cancer treatment with chemotherapy, she started to lose her teeth. She saw Dr. Peter Moy on television working with implants. Now she has new teeth.
The best thing is not to hassle with this denture business. It's an incredible situation when all your life you had a good set of teeth and then suddenly you lose your teeth.
From the dentist's point of view, when you use the guided surgery techniques, it much simplifies it. It takes all the guesswork out of it. They can work much faster and much more accurately. And the laboratory technicians then can do the prosthetics and seat them immediately in the patient's mouth.
Ruud Sips is 55 and has worked in the dental engineering industry for over 30 years. He now runs his own lab with more than 20 employees. Nobelguide has a large potential for the dental laboratories.
In a few words, it's an incredible step forward to have the opportunity to make with technical components, to fill in a good process and to increase the outcome of what we are doing in the dental laboratory, and of course increase the relation between the interdisciplinary groups, doctors and dental technicians, and of course don't forget the patients.
Of course, in Sweden, Professor Brånemark has many followers. Dr. Bengt Karlsson in Stockholm knows Professor Brånemark and has also met him in professional situations. Dr. Bengt Karlsson now runs a clinic which is keeping up with the developments.
For the first time we've been able to combine the IT technology working in computers with industrial processes like the Procera and the skill of the surgeon himself. So all this combined is now being possible to put to work, and that has never been done before.
There was no doubt that the computer-based Procera guide led to a good result. Lars Svensén, one of Dr. Karlsson's patients, can vouch for that.
Jag hade varit utrustad med starka tabletter och jag har inte använt någonting av det. Utan det var ungefär som ett tandläkarbesök. När bedövningen släppte så tog man en Albyl mot huvudvärk. Och det var allt, och sen på kvällen kunde jag äta.
And what about the future? With dental professionals, as for example 27-year-old Dr. Line Molly, the Nobelguide method will just keep on growing. She is currently in the 4th year of her PhD studies at the University of Leuven in Belgium.
The patient's point of view, mostly afterwards, they are very happy that everything goes so smoothly and they don't have swollen cheeks or colored cheeks. The pain is still comfortable, and they are amazed that, well, when we tell them it will go in 1 hour, then they are amazed that this can take place in 1 hour. And right now, the bridge is now a Procera bridge, and it's a lot better, so aesthetics are very good as well.
Als wären es meine eigenen Zähne.
Alles problemlos verlaufen, wunderbar.
I just eat anything I want to.
Det som är anmärkningsvärt är ju hur elegant det gjordes.
The outcome is more predictable than that we had before.
Very, very quick for the doctors and the patients.
It's a new era that we are entering now.
So if we have a happy patient, it makes me happy.